Good afternoon, this is Dr. Bradshaw, and this video is intended for my RAD 1611 students. I'm looking today at a A to P thoracic view, and today I'm using a digital program that's used in the clinic. And the reason I chose to use this today on this one is because I can enlarge certain areas and magnify them like this, or I can enlarge the whole thing and make it bigger like this. And so I'm going to do that right now, and I'm also going to scroll up just a little bit on the film to this area right here. And so I'm looking at this segment right here that is a thoracic segment. Now let's see, before I do that, I want to flip this over so that I have, nope, not upside down. That was wrong. I want to do that. Okay, and the reason I want to do that is because that puts then the heart on my left side, and the aorta is kind of over there, and so it orients me just a little bit better. All right, so when I'm looking at this segment right here, if I use this one right here, you can see the vertebral body, of course, is right here, all of this. And you can also see that the pedicle is this structure right here, pedicle. We can see that the spinous process comes down to right here. The inferior vertebral end plate of this segment is this, and the superior vertebral end plate is this. The transverse process is this structure right here, going up right here, articulates with the rib right there, and comes in right there. Now the rib is coming in, of course, right here, articulates with the vertebral body, up here with this vertebral body, and then there's the top edge of the rib right there. Of course, again, where it articulates with the transverse process is called a costotransverse joint. Where it articulates with the vertebral body is called a costovertebral joint. Now you notice that from right here out to here, it is whiter than it is on this side of the segment, and that's because all of this is the aorta. The aorta comes down along this one side and continues on down. This density change that is right along right here, going all the way up, right along right there, is called the paraspinal line. And again, basically we're looking at airspace that's inside the lung field versus soft tissue and fluid that is outside the lung field. We can see some of the vessels, pulmonary vessels right here, and as I pull this down so that you can see up into this area, we see the aorta again across right here. If I move on up to the upper thoracic area, let's go up into the very top of this part and look at a close-up of T1. The T1 transverse process goes all the way up, all the way up. All of that is the transverse process, and the reason it looks so big is because that TP is extended straight out to the side. This spinous process right here is the spinous process for this segment. This spinous process is the spinous process for C7. You do see, of course, the top of the clavicle coming straight across right here, straight across, and here's the medial aspect of the clavicle coming across. We do see, of course, the first rib is this one, the second rib is this one, and the third rib is here. Okay? Now, when we look at this dark space from here to here, and I move my mouse intentionally, that is your tracheal air shadow, comes down, comes down, comes down. And so then the dark area right out here in this area, and you can see the edge of that lung field right along right there on our close-up. You can see the top edge, and so that is your apex of the lung right there. We do know that this is T1 because it points up. This is 7 because it angles down. And we also can tell that the posterior rib is this part, and of course the anterior rib is this part right here coming down. If I move the film the other way and go into this section, this spinous process comes down to about right there. If I move on down into this area, this spinous process is coming all the way down to here. This one's easy to see right there, but they're very flat in the mid-thoracic area. Now as you get into the lower thoracic area, this spinous process now is the spinous process for this segment, and this spinous process is the spinous for this segment. When we are down, of course, in this area, we can see still that rib coming across, and if I go the other way and take this back to normal size, let me just do it this way. If I take this back to normal size and go you can see, of course, the heart shadow right now. The primary heart shadow is here. Flip it again so I have heart on the left, 1/3 of the heart on the right, 2/3 of the heart on the left. We can see where the heart meets the diaphragm, and that again is called the cardiophrenic angle. The cardiophrenic angle on this side is cut off the exposure, and of course I do not see the costophrenic angle. This edge that's coming across right here is the diaphragm, and so where the diaphragm meets the heart is your cardiophrenic angle. I believe that's all that I want to say about that right now. I'm going to probably pick another film and do the same thing again just to get a little bit different perspective.